Hi, NayaCare family and mamas. This is Dr. Patel, and I wanted to hop on and make this quick video because the American Academy of Breastfeeding Medicine actually came out on their stance of tongue tie. So here's the article, and it reads, Academy of Breastfeeding Medicine position statement in Ankyloglossia in breastfeeding Dyads. So how I'm going to do it, I'm just going to first of all do the short summary of it, and then we're going to dive down into exactly what is tongue tie, what is anatomy of it, how it relates to breastfeeding, and then what are the clinical considerations, how do we actually diagnose it, and then lastly to kind of last points of thoughts is treatment and who kind of really qualifies for it. So I'm super excited about this article. The authors on this article, kudos, tremendous work. They went through all the research, so we didn't actually have to. So I know there's so much work that was placed in here. So to all the authors who contributed to this, thank you from the lactation world as well, and as a pediatrician who deals with it, and appreciate and really commend all your hard work. So let's kind of dive down into it. A little tongue-tied myself right there. So what is their conclusion statement? So let's get to the heart of it. So what they say is the presence of a restrictive sublingual frenulum, a frenectomy is beneficial. So what that means is that if you really have a tongue tie that's tethered, your classical tongue tie, clipping it with the classical gold standard with the scissors is beneficial. However, there has to be clinical consideration. Someone with high levels of skill and judgment needs to actually make this decision of whether this tongue tie is actually causing issues with the breastfeeding dyad. So that's their statement. So jumping right into it, what is tongue tie? So tongue tie or anaglossia, the classical version that we usually see is when you see a band. So anatomically, the tongue is tethered to the base of the mouth, okay, the lower part of the mouth. And that tethering, that little band, allows or doesn't actually allow the tongue to move, and it is very restrictive. The tongue cannot come out beyond the lower palate, and that's what your classical tongue tie is. Now, this band, initially we thought it was maybe just cartilage or not anything harmful, but actually there is a lot more data on it that when we actually look at under a microscope and stain it and everything, it's actually oral mucosa. So it's just not a band that has nothing in it, it's actually oral mucosa. We are all born with it. We are all born with a ligament or a band that connects our tongue into our base of the base of the jaw or the floor of the mouth. This is normal. When it is abnormal, again going back to the classic and restrictive form, that's when your tongue cannot move out, and we have implications for that, and definitely, as the statement also said, that needs to be addressed. Now, why is the tongue so important in breastfeeding? So let's get to that, and then we can hop into how we actually diagnose it. So with breastfeeding, what the baby does is takes the mom's nipple and areola and brings it into the baby's mouth. So here's mom's baby's mouth, and nipple and areola is here. Now the tongue actually moves in a milking movement, and this up-down motion creates a vacuum, and this vacuum with positive and negative pressure allows that milk to come out of the breast and into baby's mouth. So as you can see, if the tongue cannot move up and down, cannot do this milking position, then yes, we will get into issues with breastfeeding. But now we have to kind of figure out, is this normal anatomy that we're dealing with, or is it actually the classical anatomy that you are causing, that the restriction is causing babies to not breastfeed well and mamas to have a lot of issues and pain? So how do you diagnose tongue tie? Well, Usually there's subjective and objective reasons. Subjective, you will have moms complaining about nipple soreness, latches not being great, a lot of trauma to the nipples. They also might feel that, their breast is not emptying properly, or they have really prolonged breastfeeding sessions that goes. Objectively, you can actually see the trauma on the nipples. With babies, they might be having suboptimal weight gain. And so those are all kind of some clinical considerations that you should have this diagnosis kind of in the back of your mind. And why do I say in the back of my mind? Is because those things, particularly if you're a new mom who is not this first time breastfeeding, has a lot of questions or just has a lot of struggles, there's more components. So you might actually hear these same issues that I just outlined with any breastfeeding dyad. Sometimes it's their latch position needs to be improved, or, for me in particular, I had a C-section. I actually preferred the football hold over the cross cradle, and that benefited me. I have like 4 deliveries, so I can tell you all of them, but in one session I had too much fluids, and so it wasn't the fact that my baby wasn't, or my breast wasn't producing much. I actually had too much fluid, and that caused my milk to be delayed. And so this automatic diagnosis, I think that's what the American Breastfeeding Medicine is trying to get away with, is that if you have issues right away, then it shouldn't be a knee-jerk reaction that it is a tongue tie that needs to be clipped or taken care of, because that's going to solve everything. So the diagnosis needs actually to be made by a clinician or that is versed in actually looking at tongue ties and the function of the tongue in relationship to breastfeeding. Definitely when I go do it, we have a whole breastfeeding session. We do all the stuff that we need to do. We actually look at how the baby is moving their jaw and their mouth, look at where the breast is in position to the latch, and then if I can hear any audible or swallows, and then also doing an oral anatomy exam to kind of figure out, okay, is the tongue moving? And here's a little caveat. What I've actually found is that, some of these babies, particularly those long, prolonged births and everything, they're kind of stuck in the vaginal canal, and sometimes these nerves that are strained are actually the cause of it, and some stretching exercises are really good. And so I usually, if I don't diagnose a tongue tie, my actual plan is I send them to craniofacial therapist or my DO, osteopathic doctors who do a lot of this movement. Also, other considerations, I just had a kiddo with a little recessed jaw. So recessed jaw means that, the tongue might not be moving properly because of the space that it was developed. And then you have to kind of figure out other means to help and support this baby. So again, the diagnosis has to be more comprehensive than just automatically moms coming in with some nipple trauma or some baby issues with breastfeeding, and automatically it's a tongue tie, we need to get it clipped. Speaking of clipping, the gold standard is the scissors, because you are now dealing with an anterior tongue tie. When you go further into the oral mucosa with buccal ties, upper lip ties or lower lip ties, again with the upper lip, if the lip is coming up while they're breastfeeding, then you don't really have to deal with it. It is actually a normal thing to have a frenulum there as well. But those actually going deeper into the mucosa with any other type of surgical interventions can cause a lot of issues. I've actually personally seen one of my babies actually getting an infection, unfortunately, because of it. Other things I've noticed is oral aversion, now that the baby does not want to put anything in their mouth because of all the surgical stuff that has happened. So before we even talk about those type of interventions, we really have to seriously think about the consequences of them. And then lastly, this decision needs to be made between the clinician who is versed in doing this and the parent. and kind of figuring out what the pathway is. Their actual input needs to be made as well, because guess what? At the end of the day, they're the ones taking care of the post-frenectomy care and dealing with breastfeeding. I've had a couple of babies who've had your classical tongue ties. I'll put on pictures later that these moms are like, you know what, I use nipple shields here and there and it was totally fine. I actually have it as well. I don't have any speech impediments. I don't have any other issues. I don't have migraines or sleep apneas. I don't think I want to do this intervention. And so again, these babies who have a tongue tie with the, what we kind of think, not the classical version of it, their tongue comes out and they're breastfeeding and doing really well. So this decision to actually clip ties should be more comprehensive than where we are, where everything is like, if breastfeeding is not going well, then automatically it needs to be fixed, and it is a tongue tie, there's posterior ties, there's buccal ties, there's lip ties, and we just need to kind of mass surgeries. On the same note, I've had families that have really benefited from getting their ties released, and moms have actually noticed and had noticeable relief. Babies have been gaining weight quite well. So in conclusion, after all of that, I love the statement. Sorry, I love the statement. So glad they came out with it and really starting to approach breastfeeding in more of a comprehensive way rather than a knee-jerk way is going to be beneficial to moms, and to actually for moms to understand that, you know, I might need help. I don't think I want to go down this way, or, you know what, I've owned this journey and I want to figure out what is best for me and my baby, and not have all the pressures that I think a lot of moms are feeling these days. I always say that I don't know when breastfeeding and became a gold standard of motherhood, because there's so much more that a mom does than just simply breastfeeding, and we need to start recognizing that. If you're in the Denver metro area, all the way up to Boulder, down to Parker, and you guys have issues with tongue ties, you need a good evaluation, please call us, notify us. We do these at home. I do an anterior clip, again, go through the whole oral anatomy. All the sessions are 60 minutes long with breastfeeding included, and we're available to come in and do those at the house. Well, thank you so much for listening to me in this pretty long video. And again, thankful for the American Breastfeeding of Medicine to be publishing that. And hopefully this helps you with your breastfeeding journey, and also helps you on the flip side, helping diagnose tongue ties more effectively and for the parents and moms in mind. Thank you so much.